Hi, in this video we are going to learn the oculomotor nerve and the other nerves that supply the extraocular muscles and the root of the oculomotor nerve and the structures that it passes through to get to the orbital cavity. So if we start with the brain stem and then get to the orbital cavity. So here is the brain stem. Here is medulla oblongata. Here is the pons and the midbrain. And behind the midbrain, there are two swelling. It's the superior colliculus and inferior colliculus. Now, if we show the third cranial nerve nuclei, the main nuclei of the third cranial nerve, this is the motor nuclei, okay? And behind it is the parasympathetic nuclei that sends the parasympathetic fiber. It's called the Edinger-Westphal nucleus. So here is the parasympathetic fibers, the Edinger-Westphal nucleus. Now, this nerve, when it's going on its way, when it reaches the sella turcica, on the lateral side of the sella turcica, there is cavernous sinus on both sides, right? Here is cavernous sinus, and through the lateral wall of cavernous sinus, along the third nerve, the other nerves also pass. So here is the third cranial nerve, and now we will draw the fourth cranial nerve, and it's at the level, the nuclei of the fourth cranial nerve is at the level of inferior colliculus, and it goes back and exit from the backside of the midbrain. So the fifth cranial nerve branches like V1 and V2 also pass through the lateral wall. So here is the fifth cranial nerve with the motor branch. Now the sixth cranial nerve, it does not pass through the lateral wall, but it does pass through the cavity of the cavernous sinus. So let's start with the third cranial nerve. It passes through the lateral wall. It divides into two branches, the upper branch and the lower branch. It has the parasympathetic fibers that follows the lower branch of the third nerve, right? So here is the fourth nerve that passes through the lateral wall as well. So the branch of the fifth nerve, which is the ophthalmic branch, V1, right? It passes through the lateral wall. On exiting the lateral wall, it divides into three branches. One, the nasociliary, one is the frontal branch, and one is the lacrimal branch. And then V2, which is the maxillary branch of the fifth cranial nerve, it passes through the lateral wall as well. But the sixth cranial nerve, remember, it passes through the cavernous sinus cavity, okay? So later on, we will make bigger diagram to explain each and do the section of the midbrain. But here, when these nerves, they pass through the lateral wall of cavernous sinus, they reaches the orbital cavity. And let's draw the back side of the orbital cavity. So if we draw here the orbital fissure, at top we will draw the optic canal, within it the nerve and the vessels. So here, let's imagine this is the back side of the orbital cavity, okay? So the different nerves that pass through the orbital cavity here. So the upper branch, when it exits from the lateral wall of cavernous sinus, it also receives a sympathetic branch from the sympathetic plexus, which is wrapped around the internal carotid artery, which I will show later. So the upper branch, it goes through and passes through the cavernous sinus, and then the nasociliary branch, and then the lower branch of the third nerve, and then the sixth cranial nerve, and the fourth cranial nerve, here you go, and the frontal and the lacrimal branch of the ophthalmic nerve, which is branch of the fifth cranial nerve, right? Now, these nerves, they enter the orbital cavity. So let's draw the extraocular muscles and then show how these nerves emerges or come out of the and then supply the different muscles. So here is the levator palpebrae superioris muscle. It has two parts. It has the involuntary and voluntary part, okay? So here is the lower eyelid, and here is the eyeball. The eyeball has extraocular muscles, which I will show here. Like here is the medial rectus muscle, this one. And then that one is the lateral, this one is the medial. And now it's the inferior rectus muscle. And this one is the superior rectus muscle. So here is the superior oblique muscle. And then the inferior oblique muscle. This is your inferior oblique muscle. Okay, so now here is the ciliary ganglion. Let's imagine we put it here somewhere here, the ciliary ganglion, okay? So these nerves, when they emerge and enter the orbital cavity, the upper branch, it will go supply the lateral palpebrae superioris, and this one will supply as well the superior rectus muscle. And it has the sympathetic fibers, remember? And the sympathetic fibers will supply the lateral palpebrae superioris, the involuntary part of that muscle. And then we have the lower branch that also passes through the superior orbital fissure, and it comes out and it supplies the medial rectus. This is the medial rectus, remember? So this one is the inferior rectus. And then the inferior oblique muscle supplied by the lower branch. And it has the parasympathetic fibers. And the parasympathetic fibers terminate in the ciliary ganglion, and the short ciliary nerve will go supply the constrictor pupillae muscle and the ciliaris muscle. Ciliaris muscle receives 95% of the fibers or more, and less than 5% goes to the constrictor pupillae muscle. So the other nerve that supplies the extraocular muscle is the fourth cranial nerve. It supplies the superior oblique muscle. And then we have the sixth cranial nerve. It also comes here and it supplies the lateral rectus muscle. So this is the lateral rectus muscle. These are the extraocular muscles in their supply. Now let's look at the different structure in more detail. Now if we do the section at the superior colliculus in the midbrain, and then how the third cranial nerve, and then do the section at the inferior colliculus and how the fourth cranial nerve emerges and what structures are there in these sections. Okay, so here is the superior colliculus section. If we show the brain, midbrain here. So here is the superior colliculus, and here is the substantia nigra here, and the red nucleus, right? So now we draw the main nucleus of the third cranial nerve. Okay, this is the main nucleus, and behind it is the Ehringer-Westphal nucleus. Okay, so these nerves, they come forward and then they emerges in the interpeduncular fossa. Now it has the parasympathetic fibers following it as well. If we look at the organization of the third cranial nerve, how the parasympathetic fibers kind of look like it's wrapping around the motor fibers. So when there is a damage to the third cranial nerve, it's always the first one that gets damaged is the parasympathetic fibers, and the other one gets damaged later. So here we show another structure that how they exit between what arteries. So here is the basal artery. The basal artery divides into the posterior cerebral artery. Here is the posterior cerebral artery, and it gives a branch to the superior cerebellar artery. In between these two arteries, there is the third cranial nerve emerging. So if here is the posterior cerebral artery and superior cerebellar artery. If we draw the circle of Willis, and how do they pass through different structures and arteries? Here is the basilar artery, the posterior cerebral artery, and the superior cerebral artery. And then we draw the internal carotid artery and its medial and anterior branches, medial and anterior branch. And then in the black, it's the anterior communicating artery, and then the posterior communicating artery. in between the posterior cerebral artery and superior cerebellar artery, there is the third nerve coming out, and it passes along the posterior communicating artery. Damage to these arteries could cause damage to the third cranial nerve. Okay, so now let's do the midbrain section at the inferior colliculus and show the fourth cranial nerve. So here is the section of at the level of the inferior colliculus. So if we draw a diagram here, and here is the sectioned midbrain, the inferior colliculus. So here is the fourth cranial nerves, and they decussate and they go back and they exit from the back side of the brainstem, and then they come forward. So now let's look at the lateral wall of the cavernous sinus. If we enlarge and take a section of the lateral wall, this is how it will look like, and how the nerves they pass through. So let's imagine this is your lateral wall of cavernous sinus. So the third cranial nerve, that is the first one to pass at the top, right? So here is the third cranial nerve that passes at the top. Before it exits, it divides into upper and lower branch, right? And here is the parasympathetic fibers following the lower branch as well. And here we draw vessel artery. It's the internal carotid artery that also passed through the cavernous sinus and then the lateral wall, and it's wrapped around by the sympathetic plexus. And if we draw this diagram outside and show how the sympathetic plexus wrap around it, and it gives a branch from these sympathetic plexus. The upper branch receives the sympathetic branch, which supplies the lateral palpebrae superioris. Now the fourth cranial nerve, it also passed through the lateral wall of the cavernous sinus, okay? And then the branch of the fifth cranial nerve, which is the ophthalmic branch, this one. This ophthalmic branch divides into three branches. It's the nasociliary branch, and then the frontal branch, and then the lacrimal branch. And this is the maxillary branch of the fifth cranial nerve. Now, if you look at the back of the cavernous sinus, the sixth cranial nerve passes through the cavity of the cavernous sinus, while the other nerves pass through the lateral wall of the cavernous sinus. So these are the structures passed to the lateral wall. Now let's look at the orbital cavity from the inside, okay? So this is the wall, the back wall of the orbital cavity. Here is the superior orbital fissure, the optic canal, and the origin of these extraocular muscles. They will make a ring around, and they will call it tendon ring. So this is the inferior rectus, and this is the medial rectus, the lateral rectus, and superior rectus. And here is the lateral palpebrae superioris, and here is the superior oblique. And this is the origin of these muscles, and they make a ring around the superior orbital fissure, and the different nerves pass through here. So this is the third cranial nerve and the sixth cranial nerve, okay? The branches of third cranial, the sixth cranial, the nasociliary branch of the ophthalmic nerve, the fourth cranial nerve, the lacrimal and frontal branches. So this is how they emerge. Now let's draw the eyeball and do the section, and then look at the intra-ocular muscles within the eyeball, right? So here is the eyeball, and if we show the first muscle, this is the constrictor pupillae, and then lateral to it is the dilator pupillae, and then there the ciliaris muscle on the other side as well, the ciliaris muscle. So if we look at the eyeball in another diagram and draw it here, so here is the eyeball again, and the different muscles. Here is the superior rectus, the medial rectus, the lateral rectus, the inferior rectus, the superior oblique muscle, the inferior oblique muscle. Let's very fast supply these muscles with different, when these nerves they come out, how do they supply again? Okay, so the third cranial nerve, right, the lower branch of the third cranial nerve, it supplies the inferior rectus, it supplies the inferior oblique and the medial rectus. So here is the sixth cranial nerve supplying the lateral rectus, And here is the third cranial nerve, upper branch, supplying the superior rectus with, and as well as the levator palpebris superioris with the sympathetic branch as well. So here we have the parasympathetic, which will fiber terminate in the ciliary ganglion, supplying the ciliaris and constrictor pupillae. Fourth cranial nerve supplies the superior oblique muscle, and that's all about the extraocular muscles and oculomotor